I'm a registered nurse for almost 15 years. I work at Stanford Hospital. I have 2 children, a son, Aiden, who's 6, and my daughter, Kylie, who's 3. It was 2016. I got a little bit of a cold. It was pretty much a cough, upper congestion. After about a week or so, I just couldn't shake it. So I went to go see my primary care physician. Tried normal kind of type of antibiotics, came back like 2 weeks later, it still persisted. Then we went back, another course of antibiotics, and now we're like 2 months out and I'm just coughing really hard. Finally, I started having a lot of chest pain where my ribs were, and it would radiate to my back. And at this point, I just thought it was really weird. But, what I do for a living, it requires a lot of strength and pulling and lifting. And so it could have been like tendonitis or something like that. So kind of just in the back of my mind, thought about it, but really wasn't obsessed over it, And then my doctor was like, let's do some tests. An x-ray came back and it was unremarkable. So the pain started migrating to different areas of my chest, and then I noticed like this isn't normal. So then we went and got another x-ray. And at this point, my rheumatologist, who got involved because she thought maybe it is something to do with my rheumatoid arthritis, she did another x-ray CT, and at that point, they saw 2 fractured ribs, and then they were getting a little more nervous, and my cough was still persisting. They tried me on antifungals, virals, all sorts of stuff, inhalers, and nothing was really helping. So then finally, my primary care physician decided to refer me over to a pulmonary specialist. From there, he went and did more like a CT scan, and then they were getting concerned. They thought that maybe it was something infectious, maybe it was fungal like TB. In the meantime, I'm just coughing, short of breath. I'm like, can't care for my kids. I'm in a lot of pain. And then they did more chest x-rays while we were waiting, and now they found more broken ribs. At this point, I think I was up to 6. My pulmonology interventionalist had said, well, it's this, and this, and then it might be cancer, but there's no way. You don't fit the criteria. You're of this age group, you don't smoke. I just wasn't that person, and that patient. So I never even questioned why it was taking so long to get diagnosed. And my doctor did a bronchoscopy and went and explored that further invasively. Honestly, I didn't even think anything of it. I thought he was just gonna go in, get a sample, we were gonna wait some more. And he did the procedure, and I remember coming out of my anesthesia, and the doctor had sat on my bed, and he said, "It's cancer." I said, "No, it can't be." And I look at my husband, and to me, it didn't even really register because that just didn't make sense. And I said, "Well, give it to me straight. How bad is it?" And he said, "It's stage 4. It's moved to your lymph nodes, and you have over 200 nodules in your lungs, both lungs." And so, I look at him and he's a mess because I just couldn't process it. It was very surreal at that time. And the first thing that came to my mind were my children. And then he said, we would have never imagined this either, Donna. But there's such good treatments out there now. That's what the doctor was saying at that point, which didn't matter to me, obviously, because I wasn't hearing it. To me, stage 4 lung cancer is a death sentence. Not just lung cancer, but most cancers. That's what I think. Stage 4 means metastasis usually, and it means that, if not soon, then, so that's what I thought. Immediately, of course, we went home and we needed to tell our family. Each individual, each member had a very different reaction to the diagnosis. And, my mom's was, well, can I give you my lung? Because then, let me try and help my daughter, save my daughter any way I can. And then everybody else was in denial. No, you need a second opinion. Or like, no, this isn't happening to us. You're too young, you don't smoke. I found myself trying to comfort them and trying to be strong. And I was the one who set look, this is how it's gonna be. We need to be realistic. This is what I'm faced against. And what I need from you guys is just pure support. We can be sad, we can be happy, but let's do it together. Like, I need people not to be in denial, not to resist this. Like, let's figure out the best way to take this on. That has always been like my goal. We went into protect and take care mode. Jump in, let's figure out what we need to do and move on. My advice would be, you have to do you know what I mean? Because everyone has different ways of coping and going through the grieving process. The pulmonologist referred me immediately to the thoracic oncologist, and that's Dr. Pata. I met with her the next day, and she was just so thorough and supportive. One of the major pieces of information that I learned was that there was a rising trend, if you will, of this diagnosis found of lung cancer found in Asian women of childbearing age, no smoking history. And specifically, it was this non-small cell carcinoma, and that there were several mutations that would qualify you to take an oral chemo. So instead of the chemo that most people get that kind of just attacks all body cells, it's very specific to the cancer cells. That sounded great. And she said there were minimal side effects. We actually did all the testing, got all the information, went home, and this now was just a waiting game. So the nurse came in and she said that I have this specific genetic mutation. The genetic mutation is called ROS1. And so that would mean that I would get to be able to take the oral chemo. And then this would be a type of targeted therapy. About a month later, we were trying to get in to see the neurosurgeon because at that time I had been having vision changes. I was losing my ability to figure out where things were. So I would reach for the door, but the door was nowhere close to my hand. But when they said that when you have lung cancer, oftentimes it metastasizes to brain cancer. It's very, very common. I honestly didn't think, there's no way. Again, I mean, there's no way that I have brain cancer. In my first appointment, Dr. Lee, who is somebody I worked with in the past, and he said, Donna, you have brain metastasis. You have 15 tumors in your head. And so, I mean, that was just, I think, we cried. That definitely hit really hard because brain cancer now meant that my mental capacity could change. And so all this time I was thinking, like, for my lung cancer, breathing would be difficult, but if I wasn't mentally, there with my children, then that really struck me hard. And so he said, well, there's, this treatment, and it's been shown to be very, very effective. And it was called CyberKnife radiation. I'd heard of radiation, and that's all I needed to hear because I was thinking, well, there goes my hair, but he said, nope, very minimal side effects. So CyberKnife is a targeted therapy where they use radiation, but they can literally go in and target just the cancer cell. And so in the other types of radiation, you could damage the normal tissue and the healthy tissue in addition to the goal of getting the cancer cells. With this one, you get less damage of your healthy tissues because it's targeted to the cancer cells. It was like a week later, we went in, we got fitted for my mask. So this was the mask that basically is customized for your face, and it's quite intimidating because it's this type of material that goes over your face and then it literally shrinks down, and then it has holes around the plastic, and that the holes strap you down to the bed where you're gonna have the radiation. So as they're explaining this to me, I'm thinking, why do I need to be strapped down? I mean, is it painful? Is it, am I gonna have claustrophobia? Like, what is gonna happen? We got fitted the day I went in. They were great. They let me pick out my music that I wanted to play during my treatments. I put on this mask, strapped down, and they put me in this like room all by myself and blasted my music, but I could just see this thing circle around, and then it would just like shine a red light, but I didn't feel anything. I didn't feel pain, I didn't feel pressure, there was no feelings. I'm like, this is great. I mean, minus having to stay still for they were like an hour of treatment. The only thing that was awful about the treatment were the medications I had to take in conjunction with them. Shortly thereafter, we did follow-up scans. So my first MRI for my brain showed 15 tumors. And after this 3-month follow-up scan, I was down to 6. My symptoms have definitely improved, and subsequent lung scans, they said that my lungs are performing at the level of a normal person's, down from 200 tumors in my lungs. Since I've been diagnosed last year with lung cancer with brain metastasis, I've had very good results. The precautionary the doctor gives you is we're basically buying time. To me, that's what I stay focused on, is just let this work as long as possible so that I could be at home with my children, and that was our goal, was to just start making great memories and, not to sit here and dwell on, what was going on, but more like enjoy every moment, enjoy your family, tell your family, don't keep it in, and don't, because I feel lucky. This is crazy. Like, I've kind of been given an expiration date. I don't know what that expiration date is. Become days, months, years, decades, hopefully. But I know now time it's not forever. And so I need to make the most of my time here. I love to post just because I'm opinionated and I like to share things that's, my children growing up and what's going on with me. And so when I was diagnosed, nothing changed. I didn't post more, I didn't post less. I was posting my journeys. This huge amount of support was coming through. People would write messages to me and say, Donna, please continue to show us how you're living life. And I came up with these things, I would call it beast mode. And I have like these fingers that I always, and I do beast mode. And that was my way of saying, I'm going full force at this. Since I had been diagnosed, every week I was planning trips, we were planning outings, we were planning meeting up with friends. And I was just like capitalizing on every moment, because for the first time in a long time, I felt incredibly hopeful, because I was like, my sense was renewed that people were good out there, and how precious life is, and how like you can't take anything for granted, and that like tomorrow's not guaranteed. And I need my kids to see that hope in me, because if, God forbid, I'm not here, like they'll remember that. They'll see that in videos, they'll see that in pictures, and I need that. I need to know that there is purpose. And like I've been trying to work on like helping just increase public awareness and getting the message out about the negative stigma around lung cancer, and then hoping people can hear my story and feel not feel alone, and feel that they're, I'm not cured, but I'm just waiting for the big cure. I'm waiting for it, and I'm gonna keep fighting until then.